Can cardiovascular disease be reversed? This is a common question, and the answer has two parts. The first part is absolutely yes, without a doubt. The second part is that it's more accurate to say that we can identify and identify early if you have cardiovascular disease. Secondly, we can transform your cardiovascular disease, or specifically the atherosclerosis, which is what we commonly refer to as plaque. We can transform your plaque. And thirdly, we can reverse the disease process. So listen to my video on the heart scan for a more thorough understanding of this concept. But I just want to say on this video that I want to dispel the myth that cardiovascular disease cannot be reversed, because it can. But in all accuracy, once we identify plaque or cardiovascular disease, atherosclerosis, we have to understand what type of plaque it is and transform it to a stable, low-risk plaque. Once we transform that plaque to something that's not dangerous inside your heart, specifically inside the wall of your artery, but something that is like a scar tissue or a scar that you would see on your body. Let's say you cut your hand and you look at your hand and you say, oh yeah, that's where I cut my hand when I was 12 years old. It's not ever going to cause me a problem, but I'll always be able to see it. That's what scar tissue plaque is like in the heart arteries. So whether you have dangerous plaque or sort of a moderately risky plaque, our first goal is to transform any plaque we see into stable scar tissue type plaque. And then lastly, we want to reverse the disease process, because when you look again at your heart scan in a year or 2 years or 3 years, depending upon the recommendation, you want there to be no new plaque. And any plaque that was there is transformed to a stable type of plaque. That's how you can know that you've done everything you can do throughout the year, 2 or 3 between heart scans, and you can know that you're fully protected from a heart attack or stroke because you've made a difference inside the wall of your arteries. That's where the problem starts to occur if a heart attack's going to happen. So listen to my video for a thorough explanation of the heart scan and know that cardiovascular disease is reversible. But the next time somebody asks you that or says the statement, you can say, it's more accurate to say cardiovascular disease, first and foremost, can be identified earlier than ever before and more precisely than ever before. Secondly, plaque can be transformed. And thirdly, the disease process can be halted in its tracks and reversed.